Good morning, dear friends. I am Dr. Arun Kohli, working as a senior consultant diabetologist with Lifespan, and I have my own clinic in Janakpuri. Today, I would like to discuss with you prediabetes. Prediabetes is a disease where generally the patients tend to have high sugar levels but are not high enough to be labeled as diabetic. The good news is if the patients they take care now, they can prevent their pre-diabetic from going to diabetes for a pretty long period. For this, the most important aspect is to take care of your health, the regularity in your diet and exercise. The basic cause for diabetes or pre-diabetes is that you are obese, overweight. Whenever you are overweight, you tend to become pre-diabetic. So important aspect is that the lifestyle modification is the mandatory part for preventing a patient from going to pre-diabetic to diabetic. The more important thing that you can do is that take good amount of diet, right amount of diet and good amount of health and exercise. There are certain signs and symptoms which are suggestive of that patient is going into diabetic mode. Most important is that patients will have certain dark spots in particular areas which are suggestive of insulin resistance. Insulin resistance is when your body is producing right amount of insulin, but because of the resistance, the body is not able to utilize it. The cause of the insulin resistance is obesity or overweight, BMI over 25. So one has to be very careful with one thing, that one has to have the right lifestyle modifications to prevent the patient from going to pre-diabetic to diabetic. The right amount of exercise means cut down on your weight. Cut down on your weight is with the help of diet and exercise. In diet, the patient should take the whole wheat grain foods, can have oats and full meal whole wheat grain bread for the breakfast. For the lunch, the patient can have high vegetable diet, which is high fiber diet, which is very effective for controlling your weight, and lots of fruits and vegetables. That will help you to cut down on your calorie intake and would prevent you from gaining weight. Exercise is again a very important part for controlling your pre-diabetes from going to diabetic stage. At least walk for 1 to 1.5 hours every day for at least 6 days a week. If the patient is following these two conditions, the chances are that the patient will go in the right direction, preventing himself from going to pre-diabetic to diabetic. Like I already said, that there are certain signs and symptoms of diabetes or pre-diabetes. The symptoms are the patient may feel thirst, the excess of urination, sometimes weight gain, fatigue. Patient is generally over fatigued and overeating. Once you have all these symptoms along with certain dark spots in your body, especially around your neck, around your armpits, one should be careful with obesity that you may be heading for diabetes.